on YouTube, you're all very welcome. I'm going to keep hitting admit and get everybody in. Hi, Keith. Lydia. Hi, Diana. Hi, Juliet. See who's on page 6. Hi, Fiona. Hi, Richard. Hello, Moya. Nice to see you. And we've got Kathy and Alison's here as well, and Attie's here. On YouTube, you're all very welcome. I'm going to keep hitting admit and get everybody in. Being seen on YouTube. There we go. That's scary when you get your own voice feeding back. Everybody well. Great. Wonderful. Well, hello and welcome to our vocal health first aid session. I'm just going to hit the button which stops you being able to unmute yourselves. It's nothing personal. It's just to make sure that we have order, and that's exactly what we want in the stay-at-home choir. It's all about order. That's complete rubbish. Welcome to Vocal Health First Aid. We are really, really lucky today to be joined by 2 experts in their own field who both have different perspectives on the question of vocal health. So if you've ever had any questions about anything to do with vocal physiology, how your voice changes as you grow up and as you age, and anything else to do with the nuts and bolts of the instrument that we're all working with, this is your chance to ask those questions. So we're joined by Dr. Jenevora Williams and Lydia Hart, and I shan't introduce them directly, I'll let them introduce themselves. So here is Dr. Jenevora Williams. Hi. Don't forget to unmute yourself. I'm going to click the button that says ask to unmute and see if that helps.
There, that worked. Hello. Thank you so much for inviting us along to chat and answer your questions. I'm Jenevora Williams. I'm a singing teacher primarily. I was an opera singer many years ago, and I've worked as a singing teacher for years, and now most of my work is training singing teachers to teach singing and working in vocal health. So I do a lot of rehabilitation work with singers who have had injuries or singers who've got problems, and I sort of patch them up and put them back together again and give them some tips and techniques to get their voices back to healthy. And to do this, we work as a team, and Lydia is part of the team. And our team, we have massage therapists, we have osteopath, we have a nutrition and fitness expert, we have a ENT consultant who will do the endoscopies and surgery, and there's somebody covering every aspect of your voice and how to look after it if it goes wrong. My other real passion is making sure it doesn't go wrong. So giving you the advice and help so that you can use your voices happily and easily throughout your life, and that if they do go wrong, it'll just be temporary and easily fixed. Okay. So that's who I am, and that's what I do. Lydia.
Hello everyone, can you hear me?
Absolutely, you're coming
fabulous.
Through
Fabulous. So lovely to meet you all. My name's Lydia. I'm a voice specialist speech and language therapist. I have been working for coming up to 5 years now. I started out working on the hospital ward, so I've worked in a few different fields. I've worked with swallowing problems and speech and communication problems, but I am a singer myself. I've sung in choirs since I was 9 or 10. I'm a church chorister by background, and so I've always been very passionate about singing and voice, and for me, being able to move into this field, bringing my clinical background as a speech therapist is really fantastic. So I work with people who have what we tend to call voice disorders, so where things have gone quite wrong with the voice, and they need some sort of clinical medical input. So I work in the hospital setting. I work alongside ENT, seeing people who have had the vocal cords looked at, maybe being diagnosed with a problem with the voice or with the rest of the throat, and then I work to help rehabilitate and get the voice back to normal, so to speak. be that working with singers, or most of the time actually working with non-singers, working with people just kind of in any old sort of day job who has experienced a problem with their voice. And then I do private work alongside Jenevora at Voice Care Centre, as she was saying, where we have a big multidisciplinary team specialising in looking after singers and singing voices.
Thank you. That's so interesting. So yes, today the voice is an instrument, and there's so much that people say about voice work and singing and creativity being, you know, so sort of mellifluous and almost sort of, what's the word I'm looking for? Intangible. But today we're dealing with nuts and bolts, real issues and real solutions. So there are some people who have started asking questions in the chat already. Please feel free, post all your questions in the chat. I'm keeping an eye on it, and I will feed them through to the wonderful team here. And let's dive straight in with a lovely question about phlegm. So we've got a question here from Meryl Stevenson. She's an ex-early music singer and soprano, and she seems to have a problem with getting sort of too much mucus and phlegm, particularly when she's singing. Is there anything else that would be causing that? Because she says she's otherwise in good health, but she just has this problem when she's singing. Meryl, if you want to post any more details in the chat, we can feed those through as well.
Well, we could probably both answer this one.
Jenevora, why don't you start off and then I'll add. Yeah.
First thing is, mucus is essential. Your larynx will not make a sound unless your vocal folds are wet with mucus. So you need mucus. Mucus is your friend, and you need to learn to love your mucus. And you need to keep it moist and flowing. So the best way to keep it wet and moving a lot is to make sure that you're properly hydrated, right? Because if you're dehydrated, your mucus will get more sticky. And to make sure that you're not in too dry an environment. So if the atmosphere is very dry, you may need to do some steaming or something to just help keep all that moist. So those are two things. You know, mucus is actually a good thing. If you feel you've got a lot of sticky mucus, that can be oversensitization of the whole system. And Lydia's nodding. I'm going to hand over to Lydia now.
Yeah. Yes, so it's important to distinguish between the presence of actual physical mucus that is definitely there, and you can cough and you can feel it come up and you can clear it, but also a sensation of persistent mucus which perhaps doesn't feel like it wants to clear. And that is more likely, as Jenevora said, to do with hypersensitivity, to do with irritation and tension in the larynx. And actually, I, in sort of clinical voice work, often work with people who have got this persistent problem. It can be part of something known as globus, which is the sensation of there being something stuck in the throat or of a lump in the throat. That can be related to other conditions. You asked about, is there anything that can cause excess mucus? And the answer is yes. Acid reflux, I'm sure you'll have often heard about in relation to the voice. And whilst this is something that is sometimes overdiagnosed and kind of overblamed as the cause of voice problems, you know, if you are getting some acid reflux, that can cause extra mucus production in the throat and actually the whole tract, including right up to the nose, because it's your body's protective mechanism from the acid. Dehydration, as we've said, possibly allergies or illnesses can all contribute to excess mucus. And everything that Jenevora said about actually being very well hydrated, perhaps keeping on top of any acid reflux or anything like that will help. And if actually it's more likely to be a sensation of something stuck there, irritation, tension, rather than the physical presence of mucus, then actually drinking lots of water and avoiding what is very tempting to do, lots of coughing and throat clearing. If there's nothing actually there to clear, then that's not very useful. And that actually just serves to heighten the irritation and hypersensitivity. So that is something usually to be wary of.
I'm going to add one more thing here.
Yes, please.
Just seen a couple of comments popping up. One of them was the dairy thing. Now, we have got Duncan Rock coming on to talk to everybody next Wednesday evening, I think.
Yes, that's right.
And he's a nutrition and fitness expert. He will explain to you all about dairy. But I'm just going to say in advance, steal his thunder a bit, it's a myth. There is no evidence to say that consuming dairy products will create mucus. If you feel that it does, then that's your own personal response, but there is no evidence to say that it's a thing. So I'm just leaving that one there, and then Duncan can come and tell you more about it next week.
That's a lovely mic drop moment, Jenevora. We've had quite a lot of questions coming through in the chat about aging voices getting tight and being harder to use. What's the physiology behind that?
Again, we can both answer this one. I'll start. Muscles and muscle function and joints do get weaker and stiffer as you get older. It's just a thing. And your voice is no different from the rest of your body. So think about how supple and mobile the rest of your body is compared with how it was 20, 30 years ago, and your voice is going to be similar. The thing to do is to know that the more you use it and the more you keep it flexible, the better your options. So the old use it or lose it applies very, very much to your singing, as it does to any other physical activity.
And so what would your top tips be for helping? I mean, you've said keep it moving. Are there any other top tips for helping aging voices keep everything flowing, like yoga for the larynx?
Then, using it, for example, if you live on your own and you're not talking to people very much, or if you live with a partner who is hard of hearing or who you're maybe not talking to that much, you're not using your voice. So what you can do is you can make an effort to use it by reading out loud. So you can, when you're reading the paper, you can read it out loud. When you're reading a book, you read it out loud. You do some vocal warm-ups like you would before a choir practice, and you put some music on and you sing along to it. Just keep doing it. Keep singing. You don't need other people with you to enjoy singing.
And that's good. Sorry, Lydia, I'll hand over to you.
No, I was going to say absolutely. Excuse me. Everything you say there is the advice that we give to people. You know, it's we have a fair number of people who come through to ENT noticing changes to their voice and the way their voice is working as they've got older. They're finding their voices weaker. They don't have the same stamina. They perhaps, if they're a singer, don't have the same range that they used to have. And the advice we give is exactly as Jenevora said. Use it, use it or lose it. Exactly. You need to look at your voice as muscles and you need to keep those muscles working. So I often use the analogy, much if, you were to spend a lot of time sitting around and your legs are getting weaker, then you're going to find walking more and more difficult, and the voice is the same. So reading aloud, getting on the phone more, speaking out loud more, doing voice exercises. And actually, if it's a sort of non-singer or somebody who only sings a very little bit who's come through, then quite often I will take them on for a course of voice therapy where I actually teach them voice exercises, because as singers we're familiar with what these are, but for people who have never sung before, actually coming to have some sessions with a voice therapist will give them those tools to do regularly. We usually say 2, 3, 4 times through the day, do your voice exercises just to keep everything ticking over. That's your vocal yoga.
Use it or lose it. That's a really
exactly
high level mantra to remember. Now, you're saying use it or lose it when you're easing back into vocal use. Particularly, that should be useful. I've seen someone talking about getting back into singing after a long hiatus. Now, to look at it from the other perspective, we've been asked, what happens if you've got a sore throat? Should you stop singing altogether?
Lydia, you could start with this one.
I think it very much depends on the nature of the sore throat and how you are feeling. If you have a sore throat, it's probably because you're a bit unwell. And as a general rule, pushing and using your voice too much, be it speaking or singing when you're in that state, might not be the best idea. But equally, the flip side, people will often think that if they have a sore throat or they're getting a bit of a hoarse voice, they need to completely rest their voice and stop talking entirely. And most of the time, that isn't necessarily the best thing to do either. And it's finding that happy medium within what feels right for you. So actually keeping the voice moving. The vocal cords, they want to be moved, they want to be stretched, they want to be flexible and hydrated. They want, to have a bit of steam, and then some gentle voice exercises through that time is usually the best way to keep the voice going, because quite often if you struggle with your voice and you have a period of not using your voice at all, getting back into it again, then you might experience some problems. So actually keeping things ticking over is a good way to look at it, as long as you're not causing yourself any negative feelings of discomfort or pain.
We've learned a lot actually from sports research that, for example, when you sprain your ankle, 20 years ago, you would have had it bound up in a bandage and be told to go home and rest it. Now you are sent home and told to move it, get walking, get using it as much as possible, because we know that stretch and massage for the soft tissue will really help healing much, much more efficiently. And the same is true for the voice. Stretch and massage for the vocal folds. How do we stretch and massage our vocal folds? You can't get in there, you can't do it. The best way to do it is very gentle pitch glides through your voice. So you do a semi-occluded tract exercise, which is something like a buzz or a hum or singing through a straw, something like that. And if you do a and go right up through your pitch range and right down, slowly, gently, start small and gradually get bigger and bigger and bigger until you're covering your whole pitch range, and do that up and down for 1 or 2 minutes. That is giving a really lovely, gentle stretch and massage for your voice all the way through, and it will feel better and it will feel clearer and easier. And if you're doing it gently on a buzz, you're not going to hurt it at all. It's totally safe.
Yep, agreed. And to add to that, that's a very healthy thing to do to actually keep your voice, because it's a common thing for people to lose their voice when they're unwell with a sore throat and a cold, and most of the time that's not because the vocal cords are suddenly unable to work. They can still work. It's more of a response that the sort of brain is having to the pain and the discomfort, and so you kind of end up whispering, but actually it's much better, as Jenevora said, to keep the voice going, to keep it moving. And so doing those kind of pitch glides on the semi-occluded sounds help maintain your voice so that you're not actually having periods of time where you feel as if you've lost your voice.
And it has actually been shown to reduce inflammation.
Yep.
So you will reduce inflammation faster, more efficiently by buzzing up and down than by just being quiet.
Thank you so much. And we've had a question through from a few people now about what if you have sort of a problem that means that you're getting irritation on the vocal folds quite regularly, like asthma, for example, if you need to cough and you're constricting for other reasons. Are there anything that you can do to sort of counteract that and help to keep your voice healthy?
I would suggest a review of medication.
Right, great.
Lydia?
So just to touch on the asthma thing, and most people with asthma will be using inhalers, and of course that's an important part of the management of the condition. Anything that is inhaled through the mouth down to the lungs will come into contact with the larynx, and so the advice we give for people using inhalers, and as Jenevora said, actually having a review to make sure that you are having the correct inhalers and the correct dose, and you're not using the wrong one or too much or anything like that. So you've just got the minimum amount that you need. The advice for using inhalers is to use a spacer always, because that will help more evenly distribute the inhaler, so that you're not just getting it all landing in your throat. It will help it more evenly distribute down to the bottom of the lungs. And then is to gargle after using your inhaler, just to clear any residue from the upper part of the vocal tract. And then perhaps doing some steam inhalation as well, as we've already mentioned, just to help hydrate and get everything moving. Coughing and chronic coughing, cough hypersensitivity, as you've said, people who find that they do have this constant sort of need and irritation in the throat that makes them cough a lot, that is something that to a degree can be helped and controlled. And as a voice and upper airway specialist, I do work with a lot of people suffering from a chronic cough. And a lot of the time, a cough that is caused by irritation and sensitivity in the throat can be improved through improving voice care, improving vocal hygiene, drinking lots of water, being well hydrated, steaming, avoiding the urge to clear and cough your throat wherever possible, because otherwise we get sort of stuck in this cycle of it being more and more irritated, and therefore you coughing more and more.
Yeah. Thank you. And obviously, the if you're ending up coughing more and more, then you're just irritating yourself, aren't you?
Absolutely, it's a vicious cycle.
Yeah.
Vicious cycle. Now, I thought it would be nice to maybe ask a couple of questions that are coming directly from people themselves. So what I'm going to do is I'm going to hit that magic button, which lets people unmute. Please treat it with caution, everybody. And I'd like to go to now. Who have I written down? I'd like to go to Mary C. Mary C, are you around? You should be able to unmute yourselves now. There we go. Mary, are you around? Would you like to ask your question in person? I'm just gonna, there you go. Hi, Mary.
Yeah, I'm here. Hi, I'm here. Can you hear me?
Loud and clear.
Okay, about a year ago, I lost my voice. I had a cold, lost my voice, and was referred to ENT, who diagnosed silent reflux, which I then found was all over the internet. I was interested in what you said about it's often overdiagnosed. My speaking voice came back last December, January, but and it's still a bit croaky. My singing voice was terrible. I couldn't really sing. Funnily enough, joining the stay-at-home choir has been amazing, and the breathing and has helped loads. But I'm still, my range is poor. I can't sustain notes. Yeah, just any tips really.
Great, thank you. You might be on mute, guys. Oh, can't unmute yourself. There you go. There you go, Jen.
Thank you. Yes, if your voice really disappeared and you're gradually getting it back, it's going to feel very rusty, and it's going to feel like quite a struggle. And it is similar to, you know, if you've been lying in a hospital bed for 6 months, immobile, it's going to take you a while to get back. Now, you will have been given, you know, physical therapy to get your body back in line if that were the situation. So you need to think of your voice the same, getting back. And the speaking voice sounds like it's there. Obviously, you've been speaking, it's coming back. So do the same with your singing voice, and start gently and slowly, and start with the pitch glides that I just demonstrated. Somebody asked me to do it again, and it's just a buzz. I'm doing it on a v, but you can do it on a z or a v or a b or any buzz like that, or a brr, okay? And you just do a little v, so that's going up and down in your speaking range. Yeah, and then you just gradually increase it, and do it very gently, and enjoy the slide. Don't try and get the bottom and the top. It's the slide that's important. And then you gradually extend it. And it might take you a couple of weeks of doing it every day to extend it and extend it so that upper range feels comfortable. But there are two really important things. One is, if it's not working or it feels uncomfortable, go back a stage. This is the same with any rehabilitation. Yes, Don't push yourself beyond the comfort. Yep, stay with what you do well, stay with what is comfortable, work that, gradually nudge the boundary. If the boundary gives and you can go a little bit further, that's great. As soon as it cracks or feels wrong, come back. Yep, and gradually build, because then you're building on healthy and happy and easy function rather than pushing. As soon as you push into uncomfortable, everything else will lock on and you encourage the bad habits to come in.
And this also feeds into a couple of questions that I've seen about people saying, do we need, if we're feeling uncomfortable, what do we do? Should we push? Actually, no, what Jenevora is saying is go back a stage, ease it up. And I think this also feeds into a few questions I've seen about any tips for maintaining the voice and keeping it on an even keel. Is this relevant to these people too?
Yeah, I think Lydia's on mute and can't get off.
Let me have a little look. Oh, Lydia.
Yeah, maintaining a healthy voice. I mean, this is ultimately what we want, is to maintain a healthy voice rather than to leap in and fix them when they are going wrong. So maintaining a healthy voice is knowing what your boundaries are, knowing when it feels like you're pushing a bit, knowing when you're going into that slight danger zone of things getting tight, things getting sore, things feeling like they're not working so well. Our aim when we're learning technique, singing technique, is all about making it easier. It's all about learning ways to sing with less effort. You know, it's not about learning to really push and drive and get bigger and louder and fatter and faster and all of that. It's just to learn to sing with less effort, because then you can do more for longer once you're learning that technique. So gently keep doing it, and lots of small sessions of exercise is more effective than one long one.
Kindness and comfort.
Shall I just add a little bit just in answer to your question, Mary? And so as a voice therapist, the problem you've experienced where you've had a cold, lost your voice, and then it's taken quite a long time for things to start to get working again. This is a relatively common thing we see in the field of people having problems with their voice and seeking help from ENT, like you said. And most of the time it would be appropriate to be referred on to a voice therapist such as myself to help with that process. The way I always explain it to the people I work with is that the voice is a very delicate mechanism. It's a very clever instrument. It works in all sorts of fantastic, intricate ways. And there's a huge number of very small muscles that control that. I sort of like to think about it as the inner workings of a clock, and everything is just in perfect balance. And actually, when something happens like a nasty cold, illness, sometimes it's also a very stressful period or a bereavement or a shock. It can be emotional factors as well as physical ones. That can very easily kind of put a spanner in the works of the way the vocal mechanism is working. And once that system is out of balance, once it's out of kilter, it can be quite difficult for it to just get working again on its own. And that's probably why you experience these months of no voice, and then the voice still being quite croaky and the singing voice still being quite far from where you were. And that's because the body, whilst to a degree can sort of heal itself and get itself better on its own, the voice quite often needs a bit of a helping hand. And that's where, you know, people like myself on the speaking voice side of things and the kind of speech therapy side of things, and then Jenevora with the singing voice rehabilitation, that's where we come in terms of helping get your voice back on its feet.
Can I also add, I've just seen a couple of questions coming in about tips for when you feel that tension coming in, what to do about it. Yeah, it's very difficult when you feel things tightening up and getting uncomfortable. What can we actually do? And the best thing you can do is movement. Yeah, movement is medicine. So if you feel anything tightening up around your throat and about your larynx, just gentle movements like this. Move your head a little bit and this way, and move your head a little bit this way, and loosen your jaw. and stick your tongue out and move things around. Now, if you're in a situation where it's difficult to move because people can see you, you can pretend to move. So you can do imagined movements of the head or tiny movements of the head, and you're still triggering a response in those muscles to let go. Because if you're doing this, you can't be holding and gripping with the muscles on either side here, right? They've got to be, you're distracting them. They're doing something else. So if you distract them and let them go soft, the chances are that the muscles next to them in the inner layer around the larynx itself, they will also release and let go. And you can do this with the shoulders, you can just do gentle movements. If you feel you need to get your breath moving because things have got tight, you can do hula hoops with your hips so that you can just do wiggles. I don't know whether you can see that on my camera, but you can do wiggly wigglies with your hips to move those around. You can walk on the spot. You can lift your knees up one by one. Anything that gets the body moving is going to help because it will put things back into balance. It will undo the things that are tight and knotted, and it'll stimulate and wake up the things that need to be woken up.
Amazing how simple it can be, actually. And now, just a note for our non-English speakers. I've been asked to clarify the word mucus. And Jenevora, you're probably, or Lydia, please, would you just give us a quick definition of mucus, and then we'll go on to discuss something different.
Lydia is muted. Is that your choice, Lydia? Or
you should be able to unmute yourself now, Lydia. Are you?
okay?
Yeah. Hello. You carry on, Jenevora.
Okay. Mucus is it's a protein substance actually, but it's produced by funnily enough, by mucus producing cells, which are in the membranes of the nose and the lungs primarily. But those cells also are throughout the whole of the tube that goes between the nose and the lungs. So there'll be some of them around and about the larynx as well. And mucus is produced by those cells, and it flows through along the surface of the lungs and along the surface of the nose to wash away any foreign objects. That's the main purpose, is so that when we breathe in, all the pollution and the bits of stuff that we don't want, bits of pollen and other things, infections that are flying around, they get stuck onto the mucus, which then washes back, and it's on a constant wash with little hair-like protrusions in the surface, and it's washed back so that it sits into your throat, and the stuff coming up from your lungs, it washes into your throat, and then you swallow. And we swallow about 3,000 times a day. And when you swallow, that mucus that is gathering gets picked up, squeezed out, and goes back into your food pipe, into your esophagus and down into your stomach. So you are swallowing pints of mucus during the day. Okay, and that is perfectly normal and very healthy.
So for our non-English speakers, mucus is the sticky stuff inside your nose, down your windpipe. Thank you, Jenevora.
Can I just say a bit of magic about swallowing?
Go for it.
When you swallow, your larynx squeezes and lifts. All right, and as it does that, all the mucus that is sitting in and around your larynx gets spread nicely over your vocal folds. So every time you swallow, you are lubricating your voice with your own mucus. You're not lubricating it with the stuff that you're swallowing, because that goes into your stomach, but you're lubricating your voice every time you do that swallowing action. So that is why we say, if you feel the need to cough, or you've got something irritating, or just swallow.
Or dryness. Yeah, I saw something pop up about dryness as well. When you feel the dryness catching in the throat, it's all the same principles. Swallow, have a sip of water, do some steam inhalations, make sure you're getting a good amount of water down through you in the day. And another thing just to touch on as we're thinking about it is actually whether or not you at rest during the day when you're not doing anything, whether or not you tend to be breathing through your mouth or whether or not you tend to be breathing through your nose. Our bodies are designed to breathe through the nose. The nose warms, filters, and humidifies the air so that by the time it gets down to our throat and lungs, it's lovely and moist and free from debris and irritants. If the nose is blocked, everyone will experience this when you've got a cold. When your nose is so blocked, you end up having to breathe through your mouth. And I'm sure everyone's experienced that through the night when you wake up with a mouth like sandpaper. And that irritate the throat and cause a lot of dryness, not just in the mouth, but down in the larynx as well. And so looking at whether or not you're breathing through your nose and how easy that is something that I often look at with people that I'm working with, because it's quite common for people to be breathing through their mouths more than is ideal.
Thank you. Now, we've got some fantastic questions coming up through the chat, and I want to make sure that we cover as wide a range of them as possible. So I'm just going to summarise quickly what I've seen. We'll get through those ones first, and then we'll fill in with as many extra questions as we can. So we've got a few questions coming through about male voices, especially male ageing voices and changing voices. So I'm going to go to Stephen and maybe Ben to talk about those. And then we're going to talk about a few people who've asked about hoarseness after intensive voice use. So we'll talk maybe to Robin about those, and then we'll see where we're at. So just to let you know that I am looking through the chat and we're going to address as many of these issues as possible. So Stephen, are you around? Would you unmute yourself and ask the question that you posted in the chat, please? Where are you? I'll see if I can find you. Ben Jason also had a very similar question. So Ben, if you're around, there we go. I can see you, Ben. So why don't you ask your question? Just to fill you in, Stephen's question was to do with an aging voice and getting a wobble in the male voice as he's getting older. But maybe Ben, could you also ask your question, and we'll see if we can do a double answer.
Okay, let me begin with it's a simple one, really. It's just I've always had a bit of a problem between my upper and lower registers in terms of really making it a smooth transition, either going up or going down. And I'd love to find a way of making it better, smoothing that transition.
Okay, it's like changing gear, all right, in the car. When you change gear, you are changing gear. There's no getting around it. Yeah, there's no way of magically not changing gear. You have to change gear, but you can do it really smoothly if you get the revs right. Mm-hmm. And it's very similar with the voice. If you get the revs right, you can get through the gear change. So if you are going, for example, going from your lower register into the higher one, mm-hmm. and you go at it and you push and you raise the revs, yeah, you're going to hit the ceiling, you're going to clunk, mm-hmm. Yeah, you're going to crunch the gears. If you ease off and slim it down, you will get through more easily. And the same is true for female voices too. Right. Yeah. Okay. So you ease back, you slim it off, keep it spinning, keep it moving very sort of focused, but slim and fast. Right. You get through that, and then you can go with it as you get through and above. So, and on the way down, similar. Yeah, you need to kind of negotiate your way through gently so that as you clunk down into the lower range, you don't hit it hard. Mm-hmm. Yeah, right. You go through gently.
So it's almost like I tend to get tense when I know I'm getting into that area, and probably it's the worst thing that can happen. I should be relaxing a little bit and easing off, putting less pressure, less air through, and maybe that'll smooth it. Okay, right that. Good.
Just to add a little bit to that one. So in terms of thinking about exercises and methods for that, what Jenevora has already demonstrated with the buzzy sound, doing pitch slides starting in your lower range and then moving up over that transition into your head voice, your falsetto, and down again on that sort of zzz or v sound is a really nice way to practice it. Jenevora also mentioned about blowing through a straw. I happen to have a straw here, so I can just do a very quick demonstration if we'd like. Yeah. So you can Use the straw on its own. My favorite way to use the straw is also to use a bit of water. Funnily enough, I have some here as well. And just popping the straw in the water, just an inch or two, not too deep, blowing some bubbles gently. Just tip down. And then making an ooh sound down the straw as you do that. The key here is gently. We don't want the bubbles to become too ferocious and spitting in the face, because then you're pushing too much air and volume. Backing off, keeping it nice and gentle, and then you can start to work, as Jenevora was describing before, on those pitch slides, starting smaller and gradually working higher and higher until you're working in a way where you're going up across the gear change and back down again. And talking about effort levels, tension, pushing it, the fantastic thing about this exercise is that if you start pushing and forcing the air, you will literally see it in the bubbles. So this is a really nice way to play around with those ideas of stretching, easing off, backing off the effort levels. And then the pressure, this is all to do with air pressure, and that air pressure and the narrowing of the vocal tract helps cushion and massage everything.
Right, brilliant. Brilliant. That's great. Thank you.
My pleasure.
One of the things that can happen when you're tensing up and when the machine is not quite working properly with everything in order is that you can get some hoarseness. There are some people who have been saying that they're getting a lot of hoarseness. Robin Klados, are you around to talk to us about your experience with that? Is Robin still with us? Otherwise, I'm quite happy to continue yakking, but I thought you might like to. I've seen Robin around. Maybe she's left us for a moment. Anybody else who's had an issue with hoarseness after intensive voice use? Becca, who's an alto 1, has also got the same issue. Becca, do you want to tell us a little bit about your experience?
Yeah, it just seems that I get, like Jenevora was saying, tight after a rehearsal, but also just the more I use the voice, the more it constricts and I lose range. I can go for a top note and it's just not there. I get nothing. So it's very frustrating and discouraging.
And could I also add to that, Jenevora or Lydia, before you answer, what happens if you have, as somebody said in the chat, sensory damage and you're not necessarily able to feel when something hurts? What's going on? What can we do?
Okay, the vocal folds, or the vocal cords, whatever you want to call them, they're little membranes in here, flaps, that collide and vibrate to make the sound. And they don't have any sensory feedback. We can't feel them. So, and that's really useful, all right? Because as I'm talking to you now, my vocal folds are colliding about 200 times a second. That's an awful lot going on. And if I was aware of that, it would be really distracting and quite unpleasant. Okay, so I don't need to know about that. The only time I have sensory feedback on my vocal folds is if a foreign object lands on them. Then I will feel it and I will cough it out. So those vibrations, if you think about it, that's a lot of work going on. Yeah, that's a lot of banging. If you clap your hands together for any length of time, you're going to feel the skin on your hands is a bit hot and a bit tingly. And the same will happen to the surface of your vocal folds as they're colliding. Now, the thing about the frequency of collision is that the higher you go in pitch, the higher the frequency. So female voices, their vocal folds are colliding more frequently than male voices because we're at a higher pitch. And if you're a soprano, your vocal folds are getting more of a workout than if you're an alto. So if you're used to using your voice in a certain amount per day, bit of speaking, bit of chit chat now and then you go and sing for an hour or an hour and a half in a higher pitch, that's one hell of a shift for your larynx to do. And that's a lot of collisions of the vocal folds. And the muscles that are helping those vocal folds to, oh my goodness, sorry, someone's trying to call me. Oh, go away. That's my daughter phoning me. I'm very sorry. She doesn't know. The muscles that help get you into a higher pitch, yeah, are working harder, and then so they're getting tighter. They're not used to going there and staying there. They're getting tight and they're getting tired. You can't feel that because they're inside your larynx. So the way to get around that is, when you do have a little break, is to go right down to the low range. And do a bit of creak. And that just relaxes those muscles that have gone into the high pitch and will realign everything. Right? This is for any voice. Right? You get a little break from singing, you take it right down and you buzz and you creak. And then you go to do the singing again, and you're working up into the higher pitches. You work your way in gently. Yeah.
And that creak is the word creak, or vocal fry is the sound, right?
Yeah.
Really lovely low laryngeal position, nice, slow, gentle movement for your folds.
Yeah. Yeah. Feels easy and comfortable.
Now, something that we all of the ladies in the room will have experienced, well, not will have experienced, but will experience at some point in their lives, is the menopause. And I wonder, this is a sort of, I suppose, a way of combining a few questions that I've seen in the chat. Is a sort of increased wobble or wider vibrato somehow linked to the changes that you go through when you go through the menopause?
Different women experience different changes, but the vocal folds have estrogen receptors on them. So they will respond to changing estrogen levels in the body. And so we notice this with the menstrual cycle. When you're premenstrual, you have lower levels of estrogen, and you will find that your voice may get less responsive. You may lose the upper pitch range. You may find that the mucus gets thicker, that the vocal folds themselves are slightly swollen. The various symptoms. For some women, there's no noticeable change. For other women, for 2 or 3 days, their voice is almost unusable. And similar things happen with menopause. All right? And thinking of menopause as being, we have perimenopause, which is the lead up to menopause, and you often don't know you're in perimenopause because it can be 2 to 10 years before your menstrual cycle stops. All right, so at some point you will enter perimenopause, and then you start to have these symptoms where you're not quite sure what's going on. Your voice may be less responsive, it may be unpredictable. Then once you get to menopause and beyond, yeah, you're out of the whole upsy downsy roller coaster of the hormonal upheavals, but you may well then be left with a loss of your upper pitch range. You may be left with slightly drier vocal folds. You may be left with vocal folds that are maybe a little bit edematous, a bit swollen and a bit heavier. And any of those can then lead to changes in the way that you use your voice. Now, of course, this then becomes the changes that happen when your voice ages. So, and they are different because menopause, of course, is before the aging process. Yeah, the considerable aging process. All right, we're aging from the minute we're born, but you know. So, an aging voice may lose some power, may become slightly more wobbly, and that is not to do with menopause. That is to do with the nerves, the nerve supply to the muscles getting reduced slightly. Lydia, have you got anything more?
Yes, and well, and adding on to directly to what you were just saying, where we talked earlier about the fact that as we get older, not just in our voice, but our whole body, the muscles become slightly weaker, things become slightly stiffer. And so questions that have been about actually noticing a wobble in the voice, or the voice not having the stamina that it used to, or being a bit weaker or thinner or anything like that, that is to do with those normal age-related changes that happen in the whole body and in the throat. But everyone, like everything, everyone will be affected by it slightly differently. And so some people might find that their voice is still going well into their 90s, whereas other people, once they're in their 60s, might start to notice things change. And that's just because we're all different, and the processes we experience in our bodies are different.
And if you start to develop that kind of wobble or a sort of overly wide vibrato in your voice, particularly as you're getting older, do you have any tips and tricks for avoiding that? Or if you're, conversely, we've got some choir directors in the room who are saying that they see that amongst their older members of their choir and they'd like to help them fix it. Have you got any advice for that? I know it's $1 million question, isn't it?
It is a $1 million question. Again, use. All right, the more you use the muscles, the less you will lose that nerve signal to them, and the more consistent the response will be. So using your voice a lot, you will get less of a problem with that. And balancing out so that you're not using it in an effortful way. Because if you're overworking the muscles, then they will get gripped and tired, and they are more likely to then be shaky. Right? So easy and gentle, consistent, regular use.
It's so simple and yet so powerful.
It is really simple, actually. The biggest health tips we've got for the voice are things like getting a good night's sleep, having a drink of water, and getting out and going for a nice walk.
Looking after your general health and well-being.
And emotional, like you just said, emotional health and well-being as well, because it's such an important emotional sort of indicator, isn't it?
Yeah, absolutely.
Lydia mentioned that trauma and bereavement and anxiety can have an effect on your voice. Any shift in your levels of anxiety will impact on your voice use. So any underlying worries that you have will impact on your voice use.
Yeah. And we know that because if you think about, if you're on the phone to a friend, you can tell how they're feeling from the sound of their voice. We quite literally show our emotions through our voice, through our larynx. If you're feeling sad, that feeling of the lump in the throat, that feeling of that chokiness, that's because the muscles of the throat respond to our emotions. And so when we're under any kind of long-term stresses or anxieties or worries or a sudden traumatic event, that has a very, very real effect on the voice. And
even something as emotionally nerve-wracking as hitting record on some of the recordings that we're making.
Absolutely.
I've seen some people, they suddenly get dry mouths, or they suddenly feel like they've got an increase in mucus production, and that's directly linked to their emotional state, is it?
Yes, 100%. It's part of that kind of initial degrees of that sudden sort of panicky, anxious feeling, actually, and to some degree, actually, the body kind of getting ready for, if we think into sort of fight flight mode, the heart rate goes, the nerves come, that sort of surge in feeling. And so actually, when we're talking about voice problems in that context, where you suddenly feel nervous and the voice starts to fail you and the throat starts to feel dry, actually, again, keeping it simple, focus on your breathing. Nice, slow, relaxed breathing has a very direct effect on the nervous system, and just slowing everything down, keeping you calm. And if you can keep calm and sort of level-headed, then that will on its own improve the voice, as well as perhaps doing any of the other little vocal exercises and things that we've also talked about.
I think that is such an important thing to end on, to be honest. Singing starts and ends with the breath, and sorting the breath and returning to the breath and trusting the breath are such important parts of being able to manage a consistent and a healthy performance, and make sure that that you're using your voice to the best of your ability. Ladies and gentlemen, it's been so lovely to hear all your questions. I'm sorry we've not been able to get through everybody's, but there is a way to find out more about vocal health. Isn't that right, Jenevora?
Absolutely. Absolutely, there is. We are setting up a training scheme, or we have set up a training scheme to train people in vocal health first aid. So this is for immediate help for any voice user. And we would like to see a vocal health first aider in every theatre company, every school, or in the workplace, anywhere where people are using their voices and may experience problems and will need advice. So vocal health first aid there's a Facebook page that you can go and have a look at. There is a waiting list to sign up for more information on the training. The initial training it's all online. It's about 9 hours of video content that you watch in little bites, as you go through in your own time. Cost is £55, which is, a bargain for this sort of training. The delivery is all from absolute experts. A big team of experts all delivering the material. So there's vocal health first aid. If you have a significant voice problem or you're worried about your voice, you can always come to the Voice Care Centre, which is now operating online, as well as in person. And the Voice Care Centre, you can look it up on the internet. So it's based in London, but if you're not able to go to London, you can get the help online, and we've got international clients who we're working with. And anything else that I've forgotten, Lydia?
I don't think so. I was going to finish from sort of my point of view with the clinical side of things. If you are experiencing problems with your voice that you don't feel like they're going away, they're distressing you, you're worried, then do go to your GP. Do ask for a referral to ENT. That is the sort of pathway to take. Do have a look at the Voice Care Centre website, and perhaps you could book a consultation, as Jenevora just said. And I think the main thing is, people, especially singers in choirs, often aren't aware of the complexities behind the voice and the fact that the voice is a muscles, it's an instrument, and things can go wrong. But when things go wrong, it's not a death sentence. It's not a disaster, because things can be done to help and get things working again and get things moving again. And that's what we're here for, and that's what vocal health first aid is all about. It's about raising awareness as to what to do when things do go wrong and run into trouble, because there's always a solution.
And I would just like to add to that if something does go wrong with your voice, it's not a reflection on you as a singer, on you as a musician, on you as a person, even though your voice is such a key part of how you express your identity and your individuality. If something goes wrong, it's not a reflection on you. And I speak from experience as somebody who had to stop singing for probably 2, maybe 3 years in my second and third year at university, and shortly after, when I was working out who I was as a young adult and what I wanted to give to the world as a musician. And it had an enormous impact on me, and moving through it, and the support I received from the voice care, the voice therapy with the NHS was hugely important to my development as a person. But an important part of my recovery was understanding that it's not a reflection on me as a musician, and it's not a reflection on me as a person if something does go wrong. So seek help if you have anything that you are concerned about, and ask questions, and you think you'll find a warm and welcoming environment of experts, certainly with the vocal health education and at the Voice Centre. So
absolutely.
Me to thank Jenevora and thank Lydia, and next week will be a different session with a different focus. We'll be joined by Duncan, is that right? Next week?
Duncan Rock.
Yes, who is a nutrition and fitness expert.
Yes, he's a nutrition and fitness expert. He's also a very good opera singer, and he's had roles at the Met and roles in Glyndebourne, and he's a pretty stellar singer. as well as being an expert in nutrition and fitness.
Thank you. Brilliant. Thank you so much for joining us, and everybody enjoy the rest of your weekend. Bye.
Thank
Lovely to see you all. Thank you.
Lovely to meet you all.
Bye. Right, you should be able to unmute yourselves now to say goodbye.
Oh,
Thank you so much.
Thank you.
Thank you.
Bye.
Bye.
Bye. Thank you.